Hi and good morning. I wanted to spend a bit of time today just finishing off this series on benchmark pep talks on the topic of frozen shoulder. Today we'll look a bit into the risk factors that may predispose you to having frozen shoulder. We'll have a look at what are some of the routine management options that we have out there for frozen shoulder, as well as what we specifically do in terms of physiotherapy. So first off, we'll look into the different risk factors. So if you're female and you tend to be between the ages of 40 to 60, there tends to be a higher risk of having frozen shoulder. If you're diabetic, you experience some recent shoulder trauma, you have a history of thyroid disease, or your shoulder has been immobilized for a period of time, or if you've just recently undergone shoulder surgery, all these factors may predispose you to having an increased risk of having frozen shoulder. But of course, that being said, doesn't mean that if you have these factors, you'll definitely have frozen shoulder, but it just makes you more likely to have frozen shoulder. I'll move on now to talk about some of the routine treatment options that are out there for frozen shoulder. So here I've broken it into three categories: conservative management, injection therapy, and surgery. So in terms of conservative management, we're looking at oral anti-inflammatories, painkillers, and physiotherapy. And I'll delve a bit more into what exactly we do in terms of physiotherapy for frozen shoulder later. In terms of injection therapy and surgery, usually this has to be carried out by your doctor or your orthopedic surgeon. And for injection therapy, there are two forms. One is intra-articular cortisone and local anesthetic, which can be very helpful for the initial stages of frozen shoulder, where it is very inflammatory dominant and very pain dominant. The hydrodilation is basically the injection of saline solution into the joint space, and what this does is it extends or creates more joint space for the shoulder to move in. And usually we reserve hydrodilation for shoulders that are maybe a bit less painful, but we find that they are still very, very stiff and not responding to physiotherapy. And then, of course, there is that option of surgery where you can be put under anesthesia, general anesthesia, and the shoulder is manipulated. So the surgeon will actually force your shoulder joint into end range, and that helps to free up some of that lost movement. The other thing that is routinely done also is capsular releases, where they release tight portions of the joint capsule that may be limiting your shoulder movement. So I'll finish off this last bit by talking about what we do in terms of physiotherapy for frozen shoulder. So two of the more common options that we often carry out for frozen shoulder is manual therapy and therapeutic exercise. And in terms of manual therapy, there are different joint mobilization techniques that we use. And the picture that you see here on the top right is one of the joint mobilization techniques that we use. And what it actually does is it helps to stretch out the very tight joint capsule that can then offer you a bit more range of motion. The other thing that a lot of physios also do is soft tissue release. So it can be releasing pectoral muscles, the muscles around the neck, so the upper trapezius, and maybe the latissimus dorsi. So these are some of the muscles that commonly get tight when you have frozen shoulder. And that is because usually when there's frozen shoulder, you're not moving your shoulder too much. It can be due to pain, it can be due to stiffness, but what then creates, right, is a lot of muscle tightness around the shoulder. So generally we find that a lot of patients tend to respond to joint mobilizations and soft tissue release around the affected shoulder. The other thing that's like a cornerstone of physiotherapy management for frozen shoulder is therapeutic exercise. And here I've listed 2 examples of exercises that we commonly prescribe. These are early stage exercises that you can use when you're going through like the initial stages of frozen shoulder. So pendulum exercise, which is actually this exercise that you see here on the bottom left of the picture. So you can position yourself in this forward lean position where you're supported on the table, and then using your body, you would generate some momentum that helps to give shoulder maybe like a forwards, backwards movement, a circular motion. But what that then creates, right, is passive stretch on the joint capsule, which can help to promote better movement and reduction in pain levels. The other thing that we commonly give are range of motion exercises, and this is because when you're experiencing frozen shoulder, the range of motion will tend to be limited. So an example of an exercise that you can give for forward elevation is this picture that you see here on the bottom in the center, right, where you're lying down holding a stick and just lifting your arms overhead. And this helps your shoulder 2 ways, right? So you're using your unaffected shoulder to help move your affected shoulder. And once you move overhead, you have that effect of gravity to help stretch your shoulder joint even further. So in terms of overall physiotherapy management, often what we use is a combination of manual therapy and therapeutic exercise to tackle this problem. So I hope that you found today's session helpful in understanding of what frozen shoulder actually is and what are some of the routine management options that are out there. Do remember to like, share, and subscribe to these videos and comment in the section below if you had any questions about today's topic, or if there are any topics that you would like me to cover. We'll see you next time.